We will likely be reporting out more cases over the coming week and throughout the summer.
Multiple cases of avian influenza, also known as bird flu, have been detected in wild bird populations in Manitoba. And with case counts expected to rise, the government is advising the public to exercise caution. Cases of avian influenza have been confirmed in a number of Canadian provinces, including regions of the United States immediately south of Manitoba, according to the provincial government. Samples from several snow geese and a bald eagle found in Manitoba tested positive for the virus. As a result, folks are being reminded not to touch or handle any dead birds found outside.
We want people to be safe, but we also want to understand the disease, the spread of the disease, and know what species are being affected.
Research scientist Jennifer Provencher says the public has an important role to play in helping scientists track the transmission of this particularly infectious strain of avian flu, and says if someone comes across clusters of dead birds or finds the body of a dead scavenger bird like crows or ravens, to contact the Canadian Wildlife Service.
And so the public has a great role to play in terms of reporting the species, what they are, where they are, and how they're being affected.
The Manitoba government says at this time, no known cases of the avian flu have been detected in poultry flocks in Manitoba. However, flocks infected with avian influenza have been confirmed by the Canadian Food Inspection Agency in Ontario, Nova Scotia, and Newfoundland and Labrador. On Tuesday, a duck farm in Quebec detected avian flu at 3 of its facilities, saying it will have to slaughter 150,000 birds, lay off nearly 300 employees, and it will cost several $1 million to fully restore its operations.
There can be a big risk of spread within a rehabilitation setting like we have.
The Wildlife Haven Rehabilitation Center says it has been identified as one of the province's first avian influenza cases after a sick bald eagle came into their care on April 10th. Executive Director Zoe Nakata says as a result, the center must quarantine new birds that come to them for 30 days, as well as reduce the types of birds they can care for at this time.
When it comes to waterfowl and game bird, shorebirds and corvids, we're going to have to limit the rehabilitative care that we can offer to those species, just because of the high prevalence of HPAI now that we know that it's an outbreak in Manitoba.
I wouldn't be feeding the ducks and the geese at a park at this time or this spring at all, probably.
Paula Grief, resident naturalist at Oakhammock Marsh, says avian influenza can be infectious to humans. However, transmission of the virus is extremely low. Grief suggests people limit their contact with geese and waterfowl, including reducing artificial congestion points like feeding birds at local parks and ponds.
Yeah, because really what you're trying to do when you're bird feeding is help the birds. And by bringing them together in those kinds of numbers, then you are risking more transmission of the disease. And that's what we're trying to eliminate.
Grief says bird feeders are okay to leave out as long as you keep them clean and sanitized. Manitoba Agriculture is encouraging small flock owners with free-range birds that have access to the outdoors to keep birds inside during this high-risk period of wild bird migration. In Winnipeg, Mark Neufeld, City News.